Welcome to Public Health America, a weekly program produced by BronxNet in partnership with Mercy College. I'm your host, Dr. William Latimer. Here on Public Health America, we speak with experts from an array of specialties across the liberal arts and health professions to provide you with not only the best science, but practical tips to live a healthier life. We also celebrate what studies have long documented, namely the unparalleled value of a liberal arts college education by setting the stage to pursue a career of your choice, increase lifetime earnings, and engage in civil debate. Our experts will share decisions they made and support they received that helped them to beat the odds. By sharing one or two life lessons, their stories may provide you with the inspiration and method to realize your dreams. This is Public Health America. Welcome to Public Health America. I'm your host, Dr. William Latimer. We're here today with Dr. Janelle Goodwill from the University of Chicago School of Social Work, Policy, and Practice. Janelle, welcome to the program.
Thank you so much for having me.
Our pleasure, my pleasure. So I know you've been doing some cutting edge work on suicide prevention, particularly among Black Americans. Tell us a little bit about your work.
Certainly. So I wrote my dissertation on the experiences of Black college students, particularly as it relates to issues of depression and suicide. Since finishing my dissertation and starting my faculty position here at the University of Chicago, I've done two main projects that I'm really excited about. The first is a national survey of mental health among Black adults during COVID-19. And so in that study, I'm looking at how things like hopelessness and meaning in life and life purpose are related to suicidal risk and protective against suicidal thoughts in Black Americans during the pandemic. And then in the second project, I've recently got grant funding from the National Institute of Mental Health to implement a school-based suicide prevention intervention for Black middle school students here on the South Side of Chicago. And so I'm really looking forward to moving both of these projects forward. And that's really the main things that I'm working on right now.
That's very exciting. Obviously an important topic. So let me ask some basic questions. In the epidemiology of suicidal ideation and suicide attempts, are there differences by race, ethnicity?
There are, and there's been a lot of really important work and some serious efforts that have been put forth by researchers over the past 30 years. We are seeing recent changes in the trends, which I think is something important for people and viewers to be aware of. So historically, we've seen that suicide rates are higher among young Black males relative to young Black females. But there's been some recent work led by Dr. Ariel Sheftal and others who found that actually this gap between male and female youth suicides among Black youth in the U.S., this gap is actually narrowed. So the number of suicides has actually increased among Black girls in recent years. Also, we see that among Black children, those younger than 13, they're more likely to die by suicide relative to white children of their same age group. And so while suicide has been a serious issue among Black Americans for a long time, we are seeing some really concerning trends, particularly among young children, those younger than 13, and then also these increases in girls.
Got it. And you mentioned you recently were awarded a study from the National Institutes of Health, NIMH. Congratulations. What funding mechanism did you get?
So this is an R34 to pilot a culturally adapted suicide prevention intervention in schools here.
Tell us a little bit about it.
So we'll be building upon the Signs of Suicide program. It's an existing intervention, and we're going to be implementing this across a couple of schools on the South Side. And we're interested in seeing if we get some differences in terms of changing the intervention content to be more culturally relevant and really specific to the needs of Black students here in Chicago. And so we'll compare the existing intervention content to a culturally adapted version of the intervention, and then see which students who, depending on if they were assigned to one group versus the other, which students would have better mental health outcomes at the end of the intervention.
Sure. Will the race and gender of the therapist or intervener be controlled, or how or does that matter?
Yeah, that's a really important question. Research has definitely shown that there are definitely times where having race concordant interviewers or even gender concordant interviewers can be really helpful. I think one of the interesting things about the Signs of Suicide program, this is an intervention that's longstanding. It's been implemented across several schools across the country, and over 50,000 students have already received this. So that's not something that I came up with myself. It's an existing intervention, but we are really using that as a foundation to consider how we can change this content to be relevant to Black children in Chicago. So actually, this is implemented by teachers in schools. So I think that that's really important because it's not dependent upon a research team to go in and try to be the savior for any children in Chicago. Instead, it's really helping train people who are already in the lives of children, who are already serving, who the students already know, and just providing them with additional resources and tools so that they can be the ones who actually provide the intervention there.
Got it. Got it. So what I, I remember that there used to be, at least we were trained, that rates of ideation can be quite high, but then actually acting on it and completing it uh, is a little bit lower. How does one, is that still the case? And how do you tell the difference? How do you decide when to intervene? And and again, since your focus is to specifically try to prevent suicide among Black Americans, are there any race, ethnicity issues there to pay attention to?
Certainly, yeah, those are all really good questions. And so I would say, yes, the data nationally and even globally still confirm that the number of people who seriously consider suicide is definitely higher than the people who actually go on to attempt or even complete suicide. In this, though, we do see that typically females are more likely to report seriously considering or planning an attempt, but we do see that males are more likely to ultimately die by suicide, and that's oftentimes due to the lethality of the method that they use. And so we do see gender differences and sex differences based on the type of method someone would use when they are at risk for suicide. In terms of when to intervene, I think it's important to intervene as soon as possible. And intervention looks different at different stages. I try to really communicate that while there is this myth that maybe asking someone about suicide will make them suicidal, I want to confirm that the data do not support that. So parents, loved ones, family members, friends, even teachers and administrators, I think it's important for researchers to communicate that directly asking someone if they are suicidal will not plant the idea of making them want to end their life. Instead, it can really be an open door for an opportunity to have an important conversation that the individual themselves may be reluctant to bring up to you. So directly asking someone, I think, is a great first step to intervention. The other forms of intervention include certainly getting someone into treatment with professional and licensed mental health, counselor, psychologist, social worker. I think this could also include, depending on the severity, making sure that someone has access to these resources in the community. And so I live in Chicago. The University of Chicago is on the south side of Chicago. And so this really points to why I do the work that I do with Black Americans, because there are barriers that prevent different people in our community from having access to the very mental health care that they need.
Sure. All excellent points. We've had a number of guests on the program that have talked about very disturbing trends that have been in existence for recorded time, and certainly in recent years, just acts of uh, senseless and completely unacceptable violence based on race, based on gender, based on sexual orientation, but certainly race. In your research or in the debate as it relates to suicide or suicide, thoughts of suicide, to what extent is just a heightened level of chronic and acute stress that is very extreme by virtue of racism, is that part of the discussion?
It certainly is. And I mean, there's been, I think, many Black scholars who have pointed to issues of racism for a very long time. structural forms of racism, along with individual and daily experiences of racism. People might refer to that as microaggressions or daily stressors. And so there has been studies that have focused on this, and we have seen that racism is associated with an increase in suicide risk. But I think the challenging thing with studying this topic is that there's rarely one issue that someone is facing that leads them to want to end their life. Typically, it's a culmination of events that get to the point where over a series of time, someone feels that that it really just becomes overwhelming. And so while racism is certainly a factor, I don't think it's the only factor that has to be addressed. There are so many other things that must be addressed, but also there are many strengths that Black communities, Black families, and Black individuals are looking to as sources of strength that I think definitely help support and bolster their mental health.
Sure. So looking at protective factors too. So what do you see as next steps of your work?
So next steps of my work is really locally focused. I think that while we certainly see so much happening across the nation right now, I think that still, I moved to Chicago during the pandemic and I still have so much to learn in terms of getting acclimated here. But I think it's really my responsibility to serve where I'm planted. And so nationally, I'm sure maybe you've had guests talk about this. Nationally, there's a conversation about Chicago and gun violence as it relates to homicide. But the data that I'm seeing, particularly at the county level, are pointing to some serious concerns around suicide among Black Chicago residents. And so my goal in terms of next steps is to really focus on how to best serve exactly where I am and how to take the resources that I've been afforded by being a faculty member at the University of Chicago and distribute those resources just widely across the community.
That sounds great. Very exciting work. We're going to take a quick break. When we return, Dr. Janelle Goodwill will tell us a little bit about her personal life story and her education and undergraduate experience and how that set the table for the excellent career and work she's doing today. This is Public Health America. I'm your host, Dr. William Latimer. We'll be right back.
Radio reports and newspaper headlines in the 1970s and 80s misrepresented communities in the borough of the Bronx. Then, something transformative happened. By, for, and about the Bronx, BronxNet was born.
We are BronxNet!
BronxNet provides media education,
opening the doors to competitive careers in the media industry
for thousands of students in middle school,
high school,
and college. BronxNet.
Welcome back to Public Health America. I'm your host, Dr. William Latimer. So Janelle, we always open this second part of the segment with the same question, which is, where were you born and what were some of your formative experiences?
Well, I was born in Warren, Michigan, which is right outside Detroit. And I lived there throughout all of my life. I lived in Michigan actually up until I came to Chicago to begin my faculty position here. And in terms of my formative experiences, I feel like there were just so many things that really helped shape me to be who I am today. So I was raised by my mom, and she really provided just a ton of structure and encouragement to me that really led me to know from an early age that college is something that I not only was expected to do, but that I wanted to do. And so throughout my time, and even as early as middle school and high school, we would spend time going to different colleges in Michigan in particular. And really, my mom encouraged me to dream about what I wanted to do and where I wanted to go. Other formative experiences I feel really happened in school. I went to a predominantly white school in a suburb of Detroit. And while there were certainly many benefits in terms of having maybe a smaller class size or having a lot of extracurricular activities, it definitely was challenging for me as a child and being at such a young age, always being one of the only students in my class, only Black students in my classroom. There was a certain amount of pressure that I felt to really be perfect, and that wasn't healthy. But I think that over time, my mom definitely did a great job of ensuring that I was in other spaces where I was not the only Black person. So that was really intentional in terms of, spending time with my other family members, or even being a part of a local Black church. That was just so critical to my development and to my understanding of the world around me. And so since then, I think that even those formative experiences, being one of the only Black students in school, really helped prepare me for what I was going to encounter in college, where oftentimes, again, going to a predominantly white institution like Michigan State University, where I was, again, one of the only students of color or Black students in the classroom sometime. And while that was challenging, it definitely helped prepare me so that I could be in a space where I could advocate for myself, where I could communicate with my professors and teaching assistants, and where I could really get the experiences that I felt that I needed to help prepare me to become the person that I am now.
That's great. Great story. And obviously, I'm sure your mom is exceedingly proud of you and was so critical to, your choice to attend college. So you went to Michigan State. Tell us a little bit about what was your undergraduate major? What led you there? What were the pros and cons of college life?
Yeah. Well, I tell everyone I loved college. It was just a wonderful experience. Even though it was difficult, I felt that, it was really, really a transformative time in my life. And so, as I mentioned, I studied at Michigan State University. I really benefited from going to a large public state school. My high school actually had a graduating class of 47 students. So it was quite a shock going from 47 to 47,000 in East Lansing on the campus there. I studied psychology, and I actually stayed with that major the whole time. I didn't feel the need to change my major. I was led to pursue psychology simply because I've always been interested in human behavior. Even as a kid, I thought that I wanted to become a therapist and do talk therapy, become a psychologist, and talk with people about whatever they were facing. That was something that my friends came to me a lot for when I was a kid. And so I thought that's what psychology was. But it wasn't until I was a freshman that I learned that so much of psychology is research. And so while I was there, my very first semester in the fall of 2013 at Michigan State, I got involved in a research lab, and I've been a part of research ever since. I didn't know it'd be my future career, but happy to talk about that more if interested. But yeah, that was really a turning point for me, is getting involved in a research lab and learning that I could use research to answer important questions about the world around me.
That's great. Yeah, we've had several guests that have commented on how exposure to new opportunities, in your case, research, were just critical to the road and journeys that they ultimately took. What were some other factors, during your undergraduate degree that you now look back, not too long ago, but still look back, that might have contributed to your success?
Well, I think certainly for me, I recognize that this may not be everyone's experience, but I lived on campus. That was absolutely transformative. I think that if persons are interested and able to do so, I think living on campus certainly shapes your college experience. Being able to live alongside other students and build relationships today that have lasted since that time have been really important to me. Also, I was a resident assistant, so students might be familiar with this as being an RA. I did that for financial reasons. I mean, because room and board is incredibly expensive, as we all know. And so I was a resident assistant for 3 years. And in that role, I had my room and board covered, but essentially I was also responsible for overseeing a floor of freshman students and providing them with guidance and support as they navigated all the challenges that come up in their first year. And so I would encourage the viewers that if you are really on the fence around going to college, I think that there are some serious benefits in terms of having opportunity to live alongside of and learn from other people who might be completely different from you, who might be from completely different states and countries, and living together and navigating some of those challenges in your first year of college.
Excellent points. So let me ask you this, Janelle. I sit in a number of meetings, far too many, where there is debate or people want to know, is undergraduate worth it? And I think that there's greater focus today on, will my son or daughter get a well-paying job upon graduation? Now, there is absolutely nothing wrong with that debate. I think it's worthwhile. I think we should be educating students to get jobs and not to have bone-crushing debt when they graduate.
Right.
Just what's your sense of, like, it just seems to me that you're talking about a number of positive experiences that you had as an undergraduate that don't necessarily relate one-to-one with an outcome related to what you're going to make on your first job.
Certainly. I mean, I think that there are things that are intangible that you learn, that you gain, that you experience during those formative years as an undergraduate student. But the conversation around debt is deeply personal. I do have student loan debt, and I think that it is certainly only gotten worse for young people today. And I am walking through that right now. And so I would certainly encourage students, prospective students, and families to begin as early as possible, thinking about and really looking at some of the institutions that are nearby that might provide funding for tuition and even pursuing scholarship opportunities. I don't think that student debt has to be the only option. It certainly doesn't need to be. I think that there are way more expansive ideas around education that I would love to see us pursue. But even still, I would say that pursuing the undergraduate degree and having the opportunity to live on campus, while it didn't necessarily, maybe there's not a direct correlation between me being a professor now, I do think that it helped prepare me to give me skills that I needed to learn how to interact with others and also how to become a leader.
Thank you. So after undergrad, what was your next step?
After undergrad, I then left East Lansing and just went just an hour down the road to Ann Arbor, Michigan, which is where the University of Michigan is. So there I did my master's in social work and again got involved in research there. And it was during my master's program that I really built a relationship with a professor who ended up becoming my advisor in the PhD program. So while at the University of Michigan, I did my 2 years in the master's program. Again, I had plans to become a clinician to do therapy, but I decided to apply to the PhD program at Michigan during the very end of my master's program, and I got in. And so instead of staying in Ann Arbor for 2 years, I stayed on an additional 5 years to complete my PhD. And then after that, I came to Chicago. So much of my time was spent in East Lansing and then Ann Arbor, Michigan.
And talk just a little bit about your graduate experience, either at the master's level or the doctoral level. What were there any challenges that you faced, or was it just a great opportunity and you love doing research? And what were some of the positive things or the things that helped you succeed there?
Well, I think that with anything, there's pros and cons, and I think that life is bittersweet. And so, while it was certainly the best decision for me to continue my studies at the University of Michigan and to pursue the master's and PhD there were certainly hardships. And I don't know anyone who doesn't face hardships when they're pursuing some of these more advanced degrees, but I definitely faced a lot of loneliness at the beginning, a lot of self doubt. And I think something that some of the viewers may be familiar with is imposter syndrome, really questioning whether or not you belong in a space, whether questioning or not you really have what it takes to succeed. And so for me, wrestling with those tensions really is something that led me to pursue therapy. And so I think one of the great benefits of being a student is that colleges and universities, they have counseling centers where students can receive mental health support. And I'm not just saying this because I'm a mental health researcher. I'm saying this because this is what I live and what I do. Even to this day, I have my own therapist that I see. And so students, they typically don't have to have insurance to see the counselors on campus. And so that's a great plus. But the issues that I was facing during the beginning of my master's program definitely led me to seek professional support. And I got the tools that I needed to help me learn how to cope with stress. I think that that is so important, that there are new stressors that emerge when you step on campus, when you're taking new classes, when you're faced with maybe interpersonal problems that you've never dealt with before. And in those times, I think it's really important to seek the wisdom and the advice and the professional training of someone else who is prepared to do this. And so I sought counseling, and that was really helpful for me. And then over time, I learned how to cope with some of the stressors I was facing. And then from there, I was able to really see a lot of success in terms of my academics, but also in building relationships with other students who were facing the exact same things as I was, but maybe they were afraid to say. So over time, things got better, but I certainly want to be honest in stating that it was very difficult up front.
It's so reassuring and reaffirming and so strong and positive to hear you talk about what you just shared, because obviously you're wildly successful. You're an admittedly early career, and obviously incredibly articulate, and you're doing great stuff. But saying that therapy is something that has benefited you, I think that's an incredibly powerful message for our audience. With that, I want to thank Dr. Janelle Goodwill for joining us today. I want to thank our viewers for tuning in. This is Public Health America. I'm your host, Dr. William Latimer. See you next time. Until then, take care.